This is Pittsburgh Sunday Morning. My name's Sean McDowell. If you'd like to be a guest on the program, if you're a member of a group or organization that has an upcoming cause or event that the listening community will be interested in, doesn't necessarily have to be a local cause or event, doesn't have to be a nonprofit cause or event either. Contact me. My name again is Sean McDowell, and my email address is my first name, and you spell Sean, S-E-A-N, Sean at DVE.com. I'll get back to you as quickly as I can. Welcoming to Pittsburgh Sunday Morning for the first time, it's our friends from AIDS Free Pittsburgh. Richard Smith is here. Richard is the HIV/AIDS Project Director at the Jewish Healthcare Foundation. Richard has worked as a mental health therapist and clinical social worker. He specializes in community nonprofit development and quality management. The Jewish Healthcare Foundation Center, City Center building downtown on Smithfield. Richard, welcome to you.
Thank you.
And I was going to mention that because I'm also going to mention this to Stuart because AIDS Free Pittsburgh is also in City Center Tower downtown. That's where we did the American Lung Association Fight for Air climb this past March. So we climbed up all 45 floors of your building down there.
Really? Wow.
I actually made it to the top. I've done this for years. I'm not climbing for time because a lot of people were passing me on the left. But anyway, so I know where you guys are. So Richard Smith is here, the Jewish Healthcare Foundation downtown. That's jhf.org, 412-594-2550. And I just referenced Stuart. Stuart Fisk is here from AIDS Free Pittsburgh. Stuart's been involved in HIV research, nursing, and prevention since 1988. He has provided hospice, nursing, and medical care for persons living with HIV since 1992, with a focus on providing care for persons with substance abuse and mental health disorders. Stuart was also involved in the development and legalization of Prevention Point Pittsburgh. That's a syringe exchange program providing a broad range of prevention services for injection drug users here in the region. AIDS Free Pittsburgh, also headquartered Center City Tower downtown on Smithfield. AIDSfreePittsburgh.org, 412-586-6706. The mission of AIDS Free Pittsburgh to achieve an AIDS-free county by 2020 with no new AIDS cases, and also to reduce the rate of new HIV infections by 75%. Also by 2020. Stuart's organization, AIDS Free Pittsburgh, they partner with health systems, local government agencies, community organizations, and their clients. Everybody works together to diagnose the undiagnosed early in the course of infection, supporting efforts to reduce HIV transmission among high-risk groups, engaging people with HIV, linking them to care within 48 hours of diagnosis, increasing access to PrEP. We're going to explain what PrEP is. And again, the vision of AIDS Free Pittsburgh, a community where new HIV infections are rare, where people living with HIV receive the care they need, and young people can grow up in a world without AIDS. Our special guest this morning, again, Richard Smith. Richard, the program director at the Jewish Healthcare Foundation, project director, jhf.org, 412-594-2550. Stuart Fisk here as well from AIDS Free Pittsburgh. That's AIDS Free Pittsburgh, everything spelled out, .org, 412-586-6706. Richard, I thought we could maybe explain to everybody how the Jewish Healthcare Foundation became involved with AIDS Free Pittsburgh to begin with, because didn't you guys actually predate AIDS Free Pittsburgh here? You've been in the community for some time.
Correct. We did. Jewish Healthcare has been the fiscal agent for federal Ryan White money, which is money awarded to people who are HIV positive to help them get into supportive services for medical care since 1992. So we've been part of the HIV/AIDS community for over 20 years, over 25 years now, actually. And AIDS Free Pittsburgh came about maybe about 2.5 years, almost 3 years ago, when a group of like-minded individuals got together and thought we needed to do something to address the unknown AIDS cases in the county and the new HIV infections. We're in 2017. We have the technology and ability to end the AIDS epidemic, I guess you could say, and this is something that we were passionate about. So Jewish Healthcare got involved, volunteered our space and time to host as a fiscal agent for the funding, which was given to us by both UPMC and Allegheny Health Network, Highmark, to start this program and initiative for the county.
Richard, you just referenced Ryan White. Now, wasn't he the young guy that Elton John went to bat for, correct?
Yes. Ryan White was a young man in the late 80s, mid-late 80s, who was infected with HIV, AIDS at the time, and went to Congress to fight for rights for people who were infected.
And he wound up passing away not too long after he and Elton became pals.
Correct.
together.
He died in the early 90s succumbed to the virus.
Richard Smith, again, program director at the Jewish Healthcare Foundation. And Stuart Fisk is with us. Stuart, AIDS Free Pittsburgh launched in December, like Richard just pointed out, just like 3 years ago, almost 3 years ago, trying to end the AIDS epidemic in Allegheny County. Some of your partners include, and we've had all these folks on this program before, Allegheny County Department of Health. We just had Dr. Karen Hacker on here last week. Community Human Services, Pittsburgh AIDS Task Force, Planned Parenthood of Western PA. We've had all of them on this program before. Some statistics: 84% of all people living with HIV/AIDS in the 11-county Southwest PA region, 84% of them live in Allegheny County. 76% of new HIV infections here in Southwest PA, they occurred in Allegheny County. So Pittsburgh is the epicenter of HIV/AIDS in the whole Southwest PA region. That's a pretty big region. 11 counties we're talking.
It is, and actually, I mean, if you look at the entire state, Pittsburgh is really second only to Philadelphia as an epicenter for HIV. If you can look at our title, we picked the title AIDS Free Pittsburgh. We really are a county initiative because it's a collaboration between Allegheny Health Network, UPMC, and the Allegheny County Health Department, as well as the other partners. We're actually really, really proud and happy that that collaboration is happening, because those are collaborations that don't always happen. So the fact that these organizations came together and put significant resources behind this initiative was really heartening to us, because we really are at a point, as Rich said, technologically and medically, we know how to stop transmission of HIV in a number of different ways, and we can talk about a lot of them, but the most significant is by diagnosing people that have HIV and putting them on HIV medications.
We're going to talk about that.
Yeah, and that really in and of itself, if we can do that single thing plus PrEP, and we'll talk about that, we can end this epidemic. This is an epidemic that we've had almost no impact on nationally in the last 15 to 20 years.
HIV/AIDS. Our special guest this morning, again, that's Stuart Fisk from AIDS Free Pittsburgh, and also Richard Smith is here, project director at the Jewish Healthcare Foundation. On average, 128 new HIV cases are documented each year in Allegheny County, dating back to 2009. And we're going to get back to these figures. AGH and UPMC Presby here in Pittsburgh, they're currently treating over 2,400 patients with HIV/AIDS. AIDS Free Pittsburgh committed to supporting equal opportunity, human dignity, and racial, ethnic, and cultural diversity. And specifically, AIDS Free Pittsburgh values and encourages the active participation of communities that are most affected by the HIV/AIDS epidemic that Stuart was just referencing. People of color, people who identify as lesbian, gay, bisexual, transgender, and queer, LGBTQ, people living with HIV/AIDS. There is no cure for HIV currently. The only way to know for sure if you have HIV is to get tested. And we're going to talk about PrEP this morning. I mentioned to Richard and Stuart what it is, why it is so important. But I think it's also important to know early on here, Stuart and Richard, many in the high-risk communities are both HIV/AIDS positive. But if you have HIV, does that always lead to AIDS?
Absolutely not. In fact, people might really be surprised to know that if a healthy 18-year-old is infected with HIV and diagnosed fairly soon afterwards, their life expectancy is probably 3 to 4 years less than an HIV-negative person. So what we really need to do is to do that early diagnosis, because we can absolutely save people's lives. There's no reason why anybody should become infected with HIV and progress to AIDS in this country.
Can you have one or the other? These two diseases, they're not always found together, but frequently they are found together. Can you have one but not the other?
So the best way to look at that is HIV infection if left untreated, will cause AIDS.
Leads to AIDS.
AIDS is the sort of the end stage of that disease process. So we want people to never progress to end stage HIV disease, which is AIDS.
Right. Richard and Stuart, to get back to the figures that we just mentioned, 84% of all people living with HIV/AIDS here in the 11-county Southwest PA region, they live in Allegheny County. 76% of all new HIV infections in this region, 11 counties, Southwest PA, they occurred in Allegheny County. I've had our mutual friends from Planned Parenthood of Western PA on this program before, most recently Katie Horowitz and also Jessica Semler. And I asked them this too. Why are the HIV numbers so high here in Allegheny County? Don't the high-risk groups know about the necessary precautions, the availability of testing and medication, how easy the testing is? We'll talk about PrEP in just a moment. The high-risk HIV/AIDS groups, are they difficult to reach? Do they not want to be counseled? I actually asked our friends from Planned Parenthood, Katie and Jessica, is it a matter of they don't really want to be bothered with any sort of knowledge that can help them?
No, we don't believe that. I don't think that's what it is at all. What we see right now, the most at-risk group for HIV in Allegheny County is African Americans, Black individuals, mostly young men ages 20 to 40. But that actually, we're seeing infection rates as low as young as 13 as well. So we really usually say 13 to 40. We really believe that there's less access to health care in those populations, which means there's less access to education. There's less support in those organizations, in that risk group. And also, there's a lot of stigma in the Black community around HIV and AIDS. There's stigma in the white community as well around HIV/AIDS. However, we see a lot more stigma around the virus when it specifically comes to that community. And quite honestly, there's a lot of mistrust in the African American community with the medical community around just the history of that.
The reason I brought up the question, the difficulty of maybe addressing a high-risk group and getting them to understand, because I mentioned it again to Katie and Jessica, we were talking about the spread of STDs among teenagers in high school, even before high school. And there are so many ways to protect yourself now against STDs. When I was in college in the 70s, everything was limited as far as the ways to keep yourself disease-free. It's so much more effective these days. And I asked both of our friends from Planned Parenthood, well, why are the rates still as high as they are? And they both just sort of shrugged their shoulders and said, you ever try to talk to a teenager? So I mean, that's why I ran that by you guys. But Richard and Stuart, explain what PrEP is. We've mentioned it already a couple times this morning. Very basically, it's an HIV preventative measure in the form of a once-a-day pill.
Yeah. So PrEP is the use of a combination tablet called Truvada. It's got two drugs in it that are both used in the treatment of HIV, so they have activity against the HIV virus. A lot of research went into developing this kind of approach to biomedical prevention. What's been found is that if you take this drug once a day, your risk of becoming infected with HIV, if you're exposed to it, either through needle sharing, through drug use, or sexual activity, is reduced by close to 98, maybe 99%.
Wow.
So it's highly effective at preventing transmission. So it's PrEP is pre-exposure prophylaxis. So you take it before the exposure, and it prevents, if you're exposed to HIV, it prevents the infection from setting in. So it's highly effective. It's very safe. There's very little toxicity that's been associated with the two medications. If used appropriately, and if it's done in a medical setting where people can be screened for possible toxicities or side effects, which again are rare, but you need to screen for them.
You have to be HIV negative before you start taking PrEP, is that true?
You absolutely do. In fact, you have to, before you can start it, you have to get an HIV test to make sure that you're not already HIV positive, because if you're HIV positive, taking 2 drugs is not a good idea. We need to give you 3.
Right off of your website, Stuart, www.AIDSfreePittsburgh.org, PrEP, what it is and how does it work. PrEP works with, for example, a heterosexual male or female who does not regularly use contraception during sex with partners of unknown HIV status. So I'm sure you guys run into every day people who are rolling the dice in this HIV game with unprotected sex with an unfamiliar partner. And then you have the people Stuart just referenced, people who inject drugs. That would be PWIJ. And those same folks might share needles with other people. So you guys have a full plate like every day, year round.
Yeah, because there's certainly a lot of unprotected sex happening.
Yeah.
In fact, it's interesting. In some ways, it looks from the data like it might be easier to control the behavior of injection drug users around preventing HIV if they have access to clean needles and PrEP than it is around people who are having sex. We need to look at both populations because they're the highest risk for getting HIV.
Intravenous users?
Yeah,
Okay.
intravenous drug users if they share injection equipment or needles. But if you look at the national epidemiology or the data on who's getting HIV in the United States, one of the actual lowest numbers are among injection drug users because they have taken up the prevention technology when it's accessible to them to use clean new syringes when they inject and not to share those syringes with other people.
We're going to get back to that because I was going to ask you both about this. Our special guest this morning, it's Richard Smith. Richard is project director at the Jewish Healthcare Foundation, and also Stuart Fisk is with us from AIDS Free Pittsburgh. From your website, again, Stuart, it's important that a person gets HIV tested and testing negative prior to starting on PrEP, like you and I pointed out. And then you have to get tested every 3 months while on PrEP. And I saw one of the illustrations on your website. All it takes is the tip. So we're talking about the tip of your finger for an HIV test, right? It's simple.
Correct.
It's
That's
easy.
correct. Just a simple finger prick, a drop of blood.
What about if you're heterosexual and you're not an IV user, and if you're monogamous, should people, like my wife and I say, should we get an HIV test, or is it mostly just for the higher risk groups?
Everyone should get an HIV test at least once a year.
I didn't know that.
We were trying to routinize HIV testing among healthcare providers, and the recommendation is that everyone should at least have one HIV test.
Yeah.
I just had a Hep C test,
That's excellent, yes.
but I've never had an HIV test.
You probably should, and here's why. Even though you're in a monogamous heterosexual relationship, what we're seeing is sometimes, I think probably up to 30% of people that are diagnosed with HIV infection in the state of Pennsylvania are diagnosed with AIDS at the same time. We see people who were infected with HIV 10, 20, 30 years ago, never got tested, and end up in our emergency rooms and hospitals with end-stage AIDS, and many of them die within a very short period of time. So the recommendation is that everybody get one test. If you change sexual partners, have new sexual partners, or have shared needles for injection, you should get tested every 6 months to a year. That's one of the most ignored recommendations that the Centers for Disease Control ever made. We do not do enough testing. Somebody who is diagnosed with HIV and AIDS at the same time has probably had multiple interactions with the healthcare system through primary care, emergency room, hospitalization, where they could have gotten an HIV test and were never given one.
These are the communities that are most affected by the HIV/AIDS epidemic. People of color, people who identify as lesbian, gay, bisexual, transgender, and queer, LGBTQ, people living with HIV/AIDS. As we pointed out, there is no cure for HIV currently, and the only way to know for sure if you have HIV is to get tested. And as Richard just pointed out, even if you're monogamous, even if you're heterosexual, you should get tested for HIV. I never knew that. One of the goals of AIDS Free Pittsburgh is to increase access to PrEP. PrEP can, all it takes is the tip. That's the tip of your finger. Stuart and Richard, is PrEP available to the public? Is it free? Is it expensive? Is it covered by healthcare insurance?
PrEP is available. Most insurances cover it. Medicaid certainly covers it, which is a big deal. Most of your insurance is covered. There would be co-pays for many individuals, especially with all the different insurance plans out there. However, there is drug assistance through the company that provides PrEP. They will assist by giving you by paying the co-pays or paying the additional amounts that are owed on the medication. AIDS Free Pittsburgh also has a program for those who might not be that fortunate to have health insurance, and maybe for whatever reason can't receive PrEP or access PrEP. We can help either fund the testing for it or get you assistance for the medication.
And there are clinics where people can specifically go to get PrEP at UPMC, at Allegheny Health Network on the north side, and at the Pittsburgh AIDS Task Force, as well as Central Outreach. Anybody else doing it? There's some other primary care.
Planned Parenthood is also doing
Planned
PrEP.
Parenthood.
So it is available if people know where to go, and they can go to the website, and we'll give them all the locations where they can access PrEP. And the chances are it can be gotten very low cost or free for people.
www.aidsfreepittsburgh.org. PrEP, once again, very basically, it's an HIV preventative measure in the form of a once-a-day pill, and it can dramatically lower your chances of being infected with HIV, but you have to be HIV negative before you start taking PrEP. www.jhf.org, 412-594-2550. The AIDSFreePittsburgh.org phone number is 412-586-6706. I'm older than both of you guys. I grew up in the 60s and 70s before there was AIDS and HIV, or at least before people were aware of AIDS and HIV. But in the 80s, I vividly remember AIDS was huge news. This was a really scary situation. It was killing gay men in large numbers. It was terrifying to think about this new disease, but now over the decades, so much progress has been made fighting back against AIDS. You can live for a long time with AIDS these days.
You can, and it's preferable that you don't get AIDS. It's preferable that you, if you have HIV, that you're infected earlier in the course of disease, and you'll never develop AIDS. And you can live a long, healthy life. Really, the life expectancy for a person who is diagnosed young, early in the stages of disease, is virtually no different than anyone else.
Which references back to one of our major points is about getting HIV test. If you get an HIV test, we can see if you are infected with the virus, which would then prevent, hopefully, being diagnosed with AIDS. When we say AIDS Free Pittsburgh, when we say that our goal is by 2020 we want to have no new AIDS diagnosis, that doesn't necessarily mean new HIV diagnosis. It means that we want to make sure that we get people tested, that we know what people's statuses are, and we can prevent them, if they are HIV positive, from getting AIDS.
It's not curable yet, AIDS, but it is treatable. If you're living with AIDS, are you on medications every day?
You should be.
Okay.
Yes, you should be. So the treatment for HIV, you're right, there is no cure. The treatment is that you have to take medication every single day, and you have to really be pretty good at doing it. And that's kind of the big trick. So you have to have consistent access to health care, and you have to be willing and able to take medication every day. If you skip a lot of doses of your HIV medication, the virus can actually mutate and become resistant to the drugs, and then we kind of got to start all over again. So I run the HIV program at Allegheny Health Network, and we see a large number of patients, and a lot of the work that we do really is about supporting them to get their medications and to take them every day.
Stuart, is AIDS contagious?
HIV is infectious.
HIV is.
Yeah. So again, AIDS is just the name for the end stage of
HIV.
Of HIV disease. HIV is infectious, meaning that if you engage in certain acts that would expose you in certain ways, and it's fairly limited. So really, it's unprotected sex. The highest risk is if you engage in unprotected anal sex. Vaginal sex is also a risk factor. We don't really think that there's much risk associated with unprotected oral sex.
Okay.
And then sharing needles or injection equipment can also very easily transmit it.
Go ahead, Richard.
And
Did you want to?
just the last piece is the last way that it can be transmitted in a pregnant woman with HIV to the fetus, and the baby can be born with HIV. It's not 100% unless the woman is being treated for her HIV. And if she's being treated, the risk of the baby being born infected with HIV is less than 1%. So again, we can prevent those transmissions to babies. We hardly ever see them anymore, actually.
Part of the mission statement of AIDS Free Pittsburgh is to reduce the rate of new HIV infections by 75% and achieve an AIDS-free county here in Allegheny. Stuart and Richard, when you say normalize HIV testing, is it difficult to get people to get tested for HIV? I didn't know that I should have been tested and should be tested for HIV, my wife and I. Are they afraid of it, or is it more that they're just not aware that they should be tested for HIV? Even among the high-risk groups, you would think that they would have some idea about that.
Well, actually we see higher rates of people seeking testing that are in high-risk groups sometimes. Here's the problem. The problem is if you offer HIV testing to a person and say, look, everybody should get tested at least once. We're not going to ask you who you've had sex with and who you did drugs with at what point in your life. Just get the test. Very high proportion of people, probably including yourself, would get that test done.
Yeah.
The problem is that somebody needs to tell you you need it, and they need to offer you the test, which is why we're working very closely within the healthcare systems, in the emergency departments, in inpatient settings, and in outpatient clinics, that when people come through, our electronic health records can look back in your file and say, you've never been tested for HIV. And it will prompt the physician or the nurse to offer you the HIV test. Very high acceptance rates. So people aren't necessarily afraid to get the HIV test. They're just not being offered it enough.
Gotcha. I mentioned that we had Dr. Karen Hacker on the program from the Allegheny County Department of Health. We talked about the heroin opioid epidemic sweeping the whole country. Are you guys at AIDS Free Pittsburgh, Stuart and Richard at the Jewish Healthcare Foundation, are you being touched by this? You guys deal with IV drug users. Is it even more dangerous than ever now for those people? Besides the HIV infection risk, now there's the overdose risk with fentanyl added too. Stuart, you mentioned that the opioid heroin people right now might actually be more careful with their needles than the high-risk groups for HIV?
Well, it really depends on whether if an injection drug user has access to clean needles and clean injection equipment, which they can get in Allegheny County through Prevention Point Pittsburgh, or they can go into a drugstore and purchase those syringes if they want to. That is legal in Pennsylvania. Then their risk for getting HIV drops down. But if they're in an area where they either don't know about that protection information or can't access the prevention technology, they are at very high risk for getting HIV. There was a county in Indiana in 2015 that had one of the largest outbreaks of HIV in a small rural community that we've ever seen. And it was because there was no access to clean needles. People were injecting opioids and they were sharing needles, and it was a huge outbreak of HIV. Now, we don't know if that's happening around the United States or in rural areas in southwest Pennsylvania, but we suspect that it very well may be. We don't know because we're not out there testing enough to really detect the early stages of those outbreaks. The second piece is that there's only 2 legal needle exchange programs in the state of Pennsylvania.
What is it, Point Prevention here in Pittsburgh?
Prevention Point
Prevention
here in Pittsburgh
Point.
And Prevention Point Philadelphia. Everywhere else, there are a couple of other exchanges that are operating either very semi-legally or outright illegally. But we're not doing enough to get into that population to not only prevent disease, but also to prevent overdose and to refer people into treatment for their substance use disorders. And we need to do that. We need to make that commitment as a state, as a Commonwealth, to legalize these programs and make them more accessible. If we don't, we know that we're going to be overrun by hepatitis C and probably HIV in the long run.
That's Stuart Fisk here with us from AIDS Free Pittsburgh, and also Richard Smith is here. He's a project director at the Jewish Healthcare Foundation. Richard and Stuart, we actually don't have that much time left. The majority of new HIV infections in the Pittsburgh area are young black men. The African American community numbers not quite 20% of the entire Pittsburgh metro population. Why are the numbers so high with the young black men HIV infection rate?
That's a hard question. I would say that lack of access to healthcare is the big one, and I mentioned that earlier, but also lack of access to services or free prophylaxis, I guess is the PrEP, and lack of access to PrEP. We are in those communities. We are trying to get individuals engaged, especially ones that we consider what we call high risk. That would be men who have sex with men.
Right.
And hopefully through those efforts we can actually reduce those numbers. But it all comes down to just the lack of access to services.
You said 20% of the population is African American, but between 45 and 50% of all new HIV infections in Pennsylvania and in the United States are among African Americans. So it's a health disparity issue that has nothing to do with African Americans having more sexual partners than whites. They don't. It's not about them injecting drugs more than white people do, because they don't. It's really about access to healthcare, education, and technology that prevents the disease. And we really need to change that equation, because that's really going to help us kind of grind down the epidemic in this country and save a lot of lives as well.
Once again, 84% of all people living with HIV/AIDS in the 11-county Southwest PA region, they live in Allegheny County. 76% of all new HIV infections in Southwest PA occurred in Allegheny County. Pittsburgh is the epicenter of HIV/AIDS in Southwest PA, and on average, 128 new HIV cases have been documented each year in Allegheny County since 2009. AIDS Free Pittsburgh is committed to supporting equal opportunity, human dignity, and racial, ethnic, and cultural diversity, and specifically values. They encourage the active participation of communities that are most affected by this epidemic, the HIV/AIDS epidemic: people of color, people who identify as lesbian, gay, bisexual, transgender, and queer, LGBTQ, people living with HIV/AIDS. Again, there is no cure for HIV currently. The only way to know for sure if you have HIV is to get tested. And as Stuart and Richard pointed out, even if you're monogamous and you're heterosexual, as I didn't know this, you should get an HIV test as well, like I should. Part of the mission statement of AIDS Free Pittsburgh is to reduce the rate of new HIV infections by 75% and to achieve an AIDS-free county here in Allegheny. Richard and also Stuart, we're just about out of time. Did we forget anything? Did you guys want to bring something up here?
I think the only thing that I would say that we haven't really touched on enough is that if a person is diagnosed with HIV and is on HIV medication, that suppresses the level of the virus in their body to undetectable levels. And we have very, very good evidence that at that point that person cannot transmit HIV to another person, no matter what they do. So one way, a really important way of slowing down and stopping the epidemic is to diagnose everybody that has HIV, get them on medications, then transmissions can't occur.
The vision of AIDS Free Pittsburgh is a community where new HIV infections are rare, where people living with HIV receive the care they need, and young people can grow up in a world without AIDS. Thanks, Richard. Thanks, Stuart. The website's again, jhf.org, 412-594-2554. That's the Jewish Healthcare Foundation, and I meant to say 412-594-2550, aidesfreepittsburgh.org, 412-586-6706. Thanks again, Richard. Thanks, Stuart.
Thank you very much.
Thank you.
Richard, before we go, you wanted to add something?
Yes, HIV testing, again, back to just the tip, prick of the finger. It's a test that takes less than 20 minutes. You get the results. You can go in. There's multiple locations across Allegheny County. You can go to our website, aidsfreepittsburgh.org, and you can look to see where the testing facilities are.
This has been Pittsburgh Sunday Morning. My name's Sean McDowell.